About a year ago, I was introduced to True Niagen, a supplement specifically designed to boost a key cellular resource called NAD. That's short for nicotinamide adenine dinucleotide. And I was really impressed with the research that showed that increased NAD levels can promote cellular repair, maintain healthy mitochondria, and increase energy throughout the trillions of cells in our body. I've been taking True Niagen ever since, and I am truly persuaded, which is why I'm so excited to welcome them back to the program. Let's get into how True Niagen works. From age 40 to 60, humans can experience a 50% decline in NAD, leaving our cells with a shortage of that incredibly valuable energy resource. Additionally, things like immune stress, poor diet, even alcohol consumption can all deplete our cell NAD levels. Research suggests that increased NAD can support cellular defense against these physiological stressors. True Niagen is designed to boost NAD levels and is backed by clinical research and regulatory approvals. Now, while the research is still evolving, I am truly impressed by the possibilities surrounding NAD and the research behind True Niagen. And I suggest you check out their information for yourself. To learn more about the research, science, and to order your supply of True Niagen supplement, visit drdrew.com/TrueNiagen and use the code DREW at checkout for a special discount on orders of 3 bottles or more. So that's my website, drdrew.com/TRUNIAGEN, and use the code DREW today.
Hey everyone, it's a dose of Dr. Drew.
There, gave you guys a chance to come on in. Sorry about all that. They're saying the volume is down a little bit. Oh, someone say the volume is fine. So they're going back and forth on that.
Well, just give it a minute.
Yeah, we've had a technically challenging.
I'm going to give you both earbuds in a second.
So that's part of the problem. I've got one microphone on. So thank you guys for stopping by. 3 blackouts, Dan. Blackout is not a normal phenomenon. I would definitely look at that relationship with the alcohol. We're going to be short and sweet today, maybe about 20, 25 minutes. I want to get your questions on the thread here on Restream. Susan, oh, there it is. I didn't think I was seeing Periscope, but they're in there. Okay, volume is good. Excellent. Excellent. So, as you guys know, I rely on the University of Washington to give us our updated data. This is the longest period they've gone without updating their data. The last data in the United States that they have, let me update it here again. Maybe there will be an update right now. Was about 10 days ago. So their last data was May 14th, and here we are, May 23rd. This is the longest they've gone without updating data. It's very interesting. Laura, you could take too much vitamin D, but people can tolerate up to 10,000 units a day pretty easily. What's it like around the country? I mean, people are starting to open up. People are starting to go out. There was an interesting story of a salon haircutting woman who got COVID and had contact with 91 people. Keep an eye on that. I suspect that's going to be a good news story, and therefore the news won't report it. Because both the clients and the woman cutting the hair were wearing masks, and theoretically that should cut the transmission rate down to almost nothing. Now, it's not explicitly the usual kind of reduction of contact because they weren't 6 feet apart and there was direct contact with the cutting of the hair, but I'm going to bet that is going to be close to 0 transmissions. And we'll see. 91 people exposed. We'll see if anybody gets it. That'll be very, very interesting. Take a lot of naproxen. How much food do I have to eat so I don't hurt myself? You don't have to eat much to take your naproxen, but some people get ulcers no matter what, so be careful. Oh, Cindy, you live in Springfield where this happened. Can you do me a favor? Cindy Hoovens. When we are up and running here in the next couple of days, we'll continue to do daily shows. This one's going to be short. Tomorrow we have a bunch of guests coming in with us. And Monday we have Steve-O. But
we have to get the sound to work.
Yeah, if we can get the sound to work, that is, yeah. But Cindy, keep us updated on this. Keep after your local press and see if you can get a report on whether or not anybody has actually contracted it from that woman. And by the way, when you say Springfield, I think Springfield, Missouri, Springfield, Illinois, and Springfield, Massachusetts. So which Springfield was it? Which Springfield are you in? So please keep an eye on that for it. Brendan, yeah, getting off Suboxone is a terrifying thing. I would say the most important thing is to get down below 2 milligrams, preferably below 1 milligram. Once you get to that point, whether or not you come off it is not that big a deal in my experience. So that's my basic guidance on that, unless you're someone who's a chronic relapser, in which case you may have to stay on higher doses. Yep, Steve-O downtown, that's right. Jose, you said you're in Mexicali. I hope you're still on the thread. What's going on in Mexico? I'm hearing that Baja is exceeding its ability to meet its hospital demands, and would like to know more. And people are coming up to San Diego, I'm hearing. So tell us about that. New York death count is 84 today, which is, let's see, where were we at a high? Give me a second to look that up. 84 versus at its high, it was in the hundreds and hundreds. So it's a significant improvement. Remember, death rate is a lagger, is lagging 2 weeks behind the cases. So that means the cases are dropping dramatically too. Let's see, the death rate, daily death rates peaked out at, I don't have the actual amount. It was 4.5 per 100,000. So you can just do that math. Okay, let's go back to, oh, whoops. I just accidentally hung up on the restream. So give me a second to get back to you guys. This has been one of them days.
Happy Memorial weekend.
One of them
Well,
days.
we did a thing this morning and
It kind of threw us off.
well, it didn't give me time to set
Yeah.
everything up.
Also, I would say, and so Cindy from Springfield, I didn't see if you responded to me. Springfield, Illinois, Missouri, or Massachusetts, and can you keep 780, Monique? Thank you. So you peaked out at 780 in New York. Cindy, you got to tell me whether you can keep after your local press to tell us whether or not any of those 91 people actually got COVID. So that'll be very interesting. Monique saying 84 is a typical daily opioid death. That is true, but that's one city though. I don't know if that's one city typical. They want to hear from you, Susan. Are you doing okay this morning?
I'm okay. I wanted to set up Zoom and I'm so frustrated because I can't get the sound plug in. I got the video, but when we went to, I just have to add a little something here and I know it's going to work tomorrow.
Thank you, Sally. Yes, Missouri, Springfield, Missouri, and Cindy will stay after the press for us. Excellent. Brazil spike caused by entering the winter in the southern hemisphere. Very interesting idea. Very interesting. Thanks, Cindy. Got it. That's really interesting. Maybe Brazil's having a seasonal effect. Yeah, all biology kind of operates as an infancy, a childhood, an adolescence, an adulthood, and then aging and a dying. And so viruses run that same course as well. But it doesn't mean they can't come back. That's the thing. But we're seeing this thing die out for now. Relapse on alcohol, use to all drugs. Alcohol relapse is very common right now, no matter what your drug of choice was. Go to AA, get back on the beam, do it, get a sponsor. It's very simple. One of the things that you've heard me talk about is that Dr. John Kelly at Harvard finally published his Cochrane analysis on 12-step, and it is as good at or superior to any professionally managed treatment, and it's free. So now there's a good evidence basis for it. Practice it. Jason, you practice the basic guidelines from RCDC in terms of salon opening and what they can do to keep things safe for people. Yeah. Robbie, I don't think our immune system gets better or worse. I think that's a wrong way of thinking about it in quarantine. It's just that in isolated environments, you're more likely to have concentrated virus and more likely to get it. So the Chinese did a study. I have it from the Hill. This was, let me see if I can get the number of 300 outbreaks in 1,200 confirmed cases, okay, in 120 cities. And 80% were in the home. They were typically 3 to 5 people infected, 34% transportation setting, 1 case out of doors, and that was a 1-to-1 transmission, suggesting that ventilation, out of doors, sunlight, all that can be very helpful in reducing transmission. So any way you can bring that into your environment, that's the more important issue than worrying about our immune biology. It's much more complicated than that, unfortunately. Had an anxiety relapse because this crap had up to, a lot of people are relapsing on anxiety and depression and alcohol. Very, very common right now. Do viruses have a stronger second strain? Some do. Coronaviruses tend not to. Coronaviruses tend to stay stable in spite of their various mutations. Vaccine by October. I think we're going to have a vaccine by the end of fall. I think that's the way it's all looking because there's multiple different competitors racing toward this. I don't know about you, but I would personally sign up to be in a phase 2 trial, certainly a phase 3 trial, because they are looking good. And vaccine technologies are, something, what was that? Vaccine technologies are extremely good now, so I would go for that. Curious what I see the problem is about staying on Suboxone. People that stay on high dose of Suboxone usually are just sort of marginally okay. They're usually using other substances. They're usually not in the program, or if they are, they're not really in the program. People on low dose Suboxone, in my experience, get serious about their recovery and are not using other substances. And unfortunately, most of the physicians that prescribe Suboxone only check for opiates. They don't check for other substances. And as long as you're using other stuff, your disease is just underway.
May I interrupt
Yeah.
for a second?
Yeah.
There was a little ping on
Yes.
my computer, which
Yes.
you and I heard.
Yes.
I'm wondering if the audience could hear that.
Did you guys hear that ping that came through about 30 seconds
When I
ago?
went, uh-oh,
Tell me about that.
keep talking.
The Depakote patient, where'd she go? You should be, yes, Julie, yes, get your where'd she go? But anyway, if you're on Depakote, yes, you should be getting levels at least every year, also a CBC for sure, because Depakote can affect blood production. No, they didn't hear the ping. Susan, no ping.
I know.
No ping.
I wish I had watched it.
Yeah, Julie, I know you've been on it for years, but it's still important to keep an eye on it. Depakote is a very good medicine for bipolar, and thank you. I'm glad you're stable on that. How is Los Angeles keeping hospitalizations down? It's keeping it down by having closed down completely, and not only keeping hospitalizations down, we're keeping infections down. So Riverside County, which is we have a giant catchment area here: Riverside, Ventura, Orange County, Los Angeles County. Riverside and Ventura are open, and guess what? No increase in cases. Shocking, shocking, shocking. So you remember, when do I think I'll come back by Denver again? Soon, Michael. I think when. I want to be on Daily Blast Live once they go back to their normal production schedule. That's where all my shitstorm began, and I'll re-clarify what I was saying there. Has a report seeing more suicide than COVID deaths? Okay, so Jennifer, you're referring to one doctor's report from one hospital who reported that they were seeing a year's worth of suicide death or suicide attempts in like a week. That is one hospital's experience. You have to take that doctor at his word. I will tell you that I'm hearing a lot more depression and suicidal thinking. Whether or not we're actually going to have more suicide than than what we otherwise anticipate this time of year, I suspect we will, but I don't know that. Dave 777, the 1.5 milligrams, as you said, it's safe. You're on it, it's safe. Jason, I talked about sunlight, fresh air, ventilation, that sort of thing. So it's not due to treatment, referring to LA County cases, it's due to being closed down. Well, treatments obviously have an effect on the duration of hospitalization, so that's been getting better straight along. And there was a big study that came out today of India that showed that hydroxychloroquine is good as a prophylactic agent to prevent COVID. And a lot of doctors, a lot of patients are taking that medication. I almost prescribed it last night for somebody. Oh my goodness. Your parents think Bill Gates started the pandemic. Wow. That is paranoid thinking. And one of the things that we see whenever there is a outbreak of infectious diseases is misinformation and paranoid thought every time throughout human history. So let's just put them on the normal scale, normal spectrum, because that's what happens every time there's an infectious disease outbreak. Until we improve our science education, I imagine there's going to continue to be that kind of paranoia. How much is too much hydrocortisone? Rhoda, you have Addison's disease, meaning your adrenal glands are shut down. Too much hydrocortisone is too much, which exceeds what your normal daily production would be, which is about 300 milligrams. So stay on your normal dosing, and as low as possible is what you want to be on. Oh my gosh, Clara, if your dad thinks that Bill Gates puts a microchip in the vaccine, I worry your dad had a stroke, frankly. If he's not been paranoid the rest of his life and now he's thinking that way, that can be a thalamic stroke in older men. The thalamic strokes can get bipolar after a thalamic stroke and have funny thoughts. I didn't dismiss it in the beginning, Timothy, even though you like it. I said, listen to Dr. Fauci, and I said, don't panic. That's what I've been saying forever, and I continue to say that. I still stand by Dr. Fauci, and he's been my North Star through many pandemics, including the HIV epidemic, which is why I got on the radio. He was telling us young doctors to do this, do this. Car guy, I did not say, I said thalamic stroke, a stroke in the thalamus, which is a midbrain structure. Okay. Jesse, I don't know what you've been asking. Is corona as bad as the flu? It's worse than the flu. Dr. Fauci stated that in March, and I have adopted that and seen it now many times. And believe me, in the risk populations, it is worse than the flu. It's terrible. And in the other populations, in the non-risk, it tends to be pretty much like the flu. I did not, Andrew, see Dr. Birx's I did not see Dr. Birx yesterday, but I know the country is doing very well. I can see the data. Adam Carolla went to Texas this weekend to do stand-up. And he was tweeting today, he goes, something feels different here in Texas. Oh yeah, the Texans aren't afraid of their state government. Interesting. Yeah, and actually Dr. Fauci is coming out against prolonged lockdown, which makes perfect sense because he's a physician. He's not just a public health trained individual. He's used to making a risk reward analysis, and he's starting to look at the mental health data. He's starting to look at what happens when you push people into poverty. And he's saying the risk reward is we should no longer be in a lockdown. This is why you listen to Dr. Fauci. Any progress on prophylactics? Yes, Terry. India came out with a study today on hydroxychloroquine that looked good. And so doctors are using it prophylactically quite a bit. Entering a phase where antibody testing in known cases are making herd immunity achievable. I am not one that I believe we're going to get true herd. No, we're not going to get herd immunity before the virus burns out for the season. So no, it's not going to happen. And hopefully by the time there's a possibility of recurrence, we will have a vaccine. So that's what I'm looking to. I don't know that to be true, but that's kind of the way I think it's going to play out. Well, Ferrari, I'll respond to you again. So thank you for listening since the 1980s. Am I okay with flu shots? Will that help? There's some evidence that the MMR is actually helping in children reduce their risk of COVID, which is fascinating. I don't know if that's true or not. And I take every vaccine I get my hands on. There are not enough vaccines, in my opinion, for me or my family. So I would happily be in a phase 2 trial for the corona vaccine. Any of them. I would take that corona vaccine in a millisecond. Can I explain the second wave? Second wave means that the virus dies out for whatever reason, either because it's a seasonal virus and isn't around in the summer, or we effectively suppress it to the point that we can contain it where it does break out, and then it breaks out more ferociously in the fall. Could happen. I think we will get it under control. Will handshaking be a thing of the past? Nope. I don't believe so. People have been saying that. I can't wait to shake someone's hand. I'm looking forward to handshaking returning. But I will have my Purell. I will change my hand washing habits where I'll be washing my hands insanely and using Purell and stuff. Taryn asks, are vaccines always safe? No, they are not. They are not always safe. They can have adverse effect, which is why we have to do prolonged phase 3 clinical trials. But the technologies are getting to the point that they are pretty damn safe, where I would happily put myself on a vaccine trial because it's very unlikely to get one of those side effects. Everything opened up in Central California. That's great. You're in Poland. That's nice. Dutch news, there's 15 to 20% less suicides. And that's interesting. So less suicides in Holland. Wonder why that is. That's interesting. And Travis, thank you for calling me Glasses Man. I appreciate the reference. That's cool. Love it. Because you're referring to the Midnight Gospel, which is a Netflix animated series that I'm on. I recommend it highly. Yeah, Patrick Carolla is not going to wash his hands and he's not going to wear a mask, and I feel like that's a mistake. I do not support him on that one. But, maybe he'll move to Texas. Who knows? How do we know COVID vaccine will be safe before the long-term trials? We don't, although there are, again, some technologies that help us assess that we didn't have before. But again, the vaccine technologies are so good that the probability of an adverse event is low. I would happily take that risk. Outdoor soccer for kids, that's an interesting question. I think generally outdoors, yes, but I'm not going to say go ahead and do that. I'm not saying that. Texans are very anti-mask. Yeah, I think that's a mistake. I think you will see some little outbreaks if you don't wear your masks. I don't say you have to wear them all the time. Out of doors, distancing, that's fine. But if you're inside, wear the mask. Why not? JB, I will just he's asking about 12-step mutual aid societies. I will refer you to the head of the Harvard Psychiatric Addiction Program, Dr. John Kelly, who just published a Cochrane analysis, which got lost in this whole COVID thing, that was groundbreaking, that shows that 12-step is as effective or more than any other professionally managed intervention, and it's free. Why would you in any way demean a free treatment that's evidence-based? That's ridiculous. So evidence-based free treatment that helps people with a deadly disease. Where in the world would you not do that? And has an evidence basis to it now. Derek says there's something wrong with my browser. Maybe I'll go to Google Chrome.
And you gotta log in with a password. I'm not sure what that is.
No. I'm just going to do it for the COVID-19.
Oh.
COVID-19 dot health data. Let's do it. See if I can get to it. All right, let me look at it.
I hope everybody's having a good weekend.
Yeah, Susan, you guys like to hear from Susan. She can talk now while I'm looking at this data.
I'm trying to figure out how to get Zoom sound to connect to OBS right now. We're not doing that the whole time. Because I actually have friends coming over and
any minute, right?
No, half hour or so. They'll probably
I have to go pick up the lunch. So, okay, you are correct, sir. Looking at my Google Chrome, it is updated. In fact, it's updated beyond today. No, it isn't. No, it isn't. Wait a minute. Yeah, no, it is not updated. Let me look at United States data. And I'm looking at the infection rate and the hypothesized cases as well. United States, and we don't have everything updated. I don't know what you're seeing and what data. I tell you, one other set of data we could look at is the what's it called? The 538 or whatever they call themselves. Yeah, 538.com has some really good graphs too, but they aren't quite as comprehensive. So, nope. County of Santa Cruz, if refuses to lift, yeah, I don't know why. Does not make sense. People are addicted to fear. Some people are. The press certainly is. I agree with that. Give Susan the other AirPods so we can hear her better.
I have it.
No, this one, the good one.
Here, why don't you put them both in?
Okay. I'll put them both in.
I think it's better when you're both. Or they have to turn on.
I'm looking at your stuff here. 10 to 12 Benadryl is not good. You will get, if you take above 4 Benadryl, you actually will get agitated rather than sedated. And you'll get something called anticholinergic delirium. So taking 12 Benadryl, you might want to call your doctor. That's actually kind of serious. I've seen people get really crazy on that. Sound is bad. Sound is bad now. They hear the ocean. Static sound.
Oh, really?
Bad sound now. It's better with this. Let's just.
Wait, try this.
I think you mixed up the headphones.
Really?
Yep, I do. Better when I take it away, so that's what we're gonna do. Why don't you try one of my other headphones? I think you mixed them up. Okay. Okay, thank you for the feedback, guys. We got you.
Because it didn't go boing when it went in my ear.
It didn't go boing. So that's probably one of mine that you have. So.
No, it's the right one, right?
The left one is the good one.
Is that better?
Can you hear Susan now?
Oh, there we go. Now it's just going off my computer.
Can you hear me now, by any chance?
Yeah, it's on my computer now, so you can just use the mic on my computer.
Okay. Do you guys hear me? I'm yelling into the computer. Can you hear me now? How about that? No, still no audio.
It'll take us.
Oh, back on. Back
It'll
on.
take-
Somebody's back on. Yes. Back on. Good.
Yeah, it's going off the mic on my
Okay,
computer.
so I'm now talking to a computer that's nearby.
It's
staticky.
fine.
Here's the deal.
It's staticky?
Yeah, let's wrap it up.
All right, well.
This is a day we knew we shouldn't attempt anything.
Turn the volume down a little bit. Is that better? Okay. Yeah, when I took the earbud out, it shut everything down. So, and these earbuds might have ran out of juice too. So.
Yeah, these are not my headphones.
We'll figure it out afterwards. But anyways, just talking to the mic. I don't know, about 12-ish.
We're going to try something else. Oh, gone again? No sound again.
Okay, drop these.
Let's see if this does it. Yeah.
That's a nice long cord.
Did this restore my sound? Can you guys hear me now?
That has a mic on it, right?
It is a sign. I agree with you. Yes, it does have a mic on it.
Oh, am I in front of the
It's back. It's back. So this is working. So that's
All right,
interesting.
cool.
So good. Sorry about all that. We've had a challenging day technically. So now I've got crazy earphones on here.
Nice. They look
Oh yeah, Corolla would not put up with this. Thank you for saying.
Oh, please. God.
He would listen. Somebody just saying he'd be chewing me a new one, which is absolutely true. Did you guys hear that one I did in New York where we were having technical problems? It was one of the funniest ones ever.
Your earbuds ran out of power or something. I don't know.
Somehow we disconnected. Hi, Chris. Hi, Chris. 1 milligram Suboxone, yes. Cats and craft, depends how long you've been on it, what else you're doing, but 1 milligram or below, you're in good shape. It's the people that are up in 8, 16 milligrams that I worry about. Essential thrombocytopenia, you're an anagrelide in remission. I can't say that you're necessarily at higher risk for COVID. Obviously, any medical conditions can put you at some higher risk. So,
Okay, we should probably.
I'm not getting on live chat, Margaret Campbell says. I don't know why. Many people will be in phase 2. How many people? I don't know how many people. They're in phase 2 apparently now. Face shields in addition to face masks. Janet, you may want to do that if you're in a salon setting or if you're in a dental office for sure. Thanks, Jeans. Platelet count was over yeah. Okay. No, I have not heard any more on leronlimab, Andrew, but I have hearing some rumblings about monoclonal antibodies being effective. It's just, again, whenever they go out ahead of peer review, just be very careful. I always worry about that. There's maybe now one of the reasons they may be doing that is there may be other peer-reviewed studies coming on other products they're trying to get ahead of, but it's always suspicious when somebody does that. So, all right, you guys, thank you for stopping in. We're going to cut this one.
After Dark this week, it's pretty funny.
We're going to, oh yeah, please go over and see After Dark this week. There's some amazing stuff we get into. Is this the stuff with Norman and his poutine?
When you start laughing so hard. And
it's terrible. Oh my God, when I think about it, I still cringe.
I love the part where she says, "Is this what you talk to your doctor friends about?"
Yeah. Christina P. asked me if this is the kinds of things I talk to my physician friends about.
Put that up this week.
Yeah, Mara, poutine was, oh boy. Question about hydrolyte. Can you take it daily or only if you're sick? Susan takes it daily all the time.
I drink it a lot.
Yeah, Susan really feels like hydrolyte helps her stay hydrated. I use it sometimes when I'm running and that sort of thing. Will poutine keep the COVID away? No, it will not. Thank you, Kimberly, for liking After Dark. We like doing that.
Everybody have a great weekend.
Yeah, have a great weekend. It's Memorial Day. Time to. And by the way, it's a good day to take. This is a good weekend to take inventory of things. We've been through a war, man. It's been like the fog of war we've been through. It came, it blew over us, and now we're on the other side of it. It's time to find ways to get our life back and to heal the wounds, restore the economies, do this in a way that's effective. And do it in a way without causing any further outbreaks. So it's a good, and I think I'm in favor of small gatherings tomorrow, people that you know and you don't have any risk, and wearing and do social distancing and things. It's a time for people to just start to get back together again. So, somebody emailed. Monica Ricci emailed you about integrating OBS and Zoom. How about that?
Yeah, and she did a great job, but the only thing we didn't do was integrate the sound.
Yeah, the sound needs a separate integration. I think it needs a separate app for that.
I have to just set it up and
But she'll get it. She'll get it.
Tomorrow.
New COVID tax. Who's doing that, Davita? Ugh, that seems crazy to me. Why did so many die in New York, Carol? My fundamental opinion is the living environments there. When you look at eastern cities, which are more concentrated, less ventilation, more elevators, more trains, that's where things broke up. As you move, that's where things really got out of hand. So whether it's Baltimore, Boston, New Haven, New York City, Pennsylvania, Philadelphia, things were bad. You move west, where things are more open and spread out, much lower incidence. And if you look at the burdens suffered by the African American community, it was much more in those cities, those eastern cities, as opposed to here in Los Angeles, for instance. We have 5% of the population is African American, 5% of the COVID cases. So it's much more representative of the average distribution of the population. So people need to look at what is going on in the African American population in terms of their living environment. My suspicion is it's government housing that is bad. That's my suspicion. So we need to really improve. If we're going to improve health, that's something we've got to improve on. So it's not just access to healthcare and some of the other things we're talking about. Okay, guys, we thank you for stopping by. I'm going to wrap this thing up. And Susan, we will see you tomorrow around this time. We'll have some guests.
Yeah,
and then,
I don't know if we'll have a guest yet.
And then Monday, we will be with the great Steve-O back in our big studio,
yes, for sure.
our usual studio. So we'll see you there. And have a great Memorial Day, everybody. We'll see you tomorrow. Okay.